Hey everyone, how we doing? In this video, we are going to be talking about the one thing your medical provider needs to evaluate. Hi everyone, I'm Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy, where we help keep active adults and athletes doing what they love, doing the workouts and the sports they love without pain, rest, or multiple trips to the doctors. So I apologize for the sweaty mess right now. I just got back from 10-mile run, so this is me in the raw. I was on my run. That's always my mental clarity time, and I was thinking about a lot of you right now. So if you guys are here jumping on the live, just type in live into the comment box. If you're watching this on the replay, just type in replay, just so I give you a shout out and know that you did listen in. So the reason I was thinking about you is last night I had the pleasure of seeing an awesome, fantastic show, Loom, right in New Haven, put on by Air Temple Arts. These aerial performing circus artists are just amazing at what they do. Some of the skills, the tricks, the strength, the flexibility that's required is just amazing. And I've had the pleasure to work with a lot of these athletes throughout the year and these performers, and it was just so nice to be able to see them kind of do their craft in their element on stage with the lighting. For those that are looking for a little entertainment today, I highly recommend you get down to ACES, ECA in New Haven. Check out the show. They have performance at 1 o'clock and 7 o'clock. If you want the link to tickets, just type in link into the comment box. I will send you that link right away. But I highly recommend you guys check out the show. Thinking about that, thinking about what these artists were doing in the air, and it really got me thinking about the most important thing that a medical provider needs to evaluate when you have pain, and that is movement. So movement dictates some of the things that are going on and the contributing factors to your pain. So every single client of mine, whether it is a runner, whether it's a gymnast, whether it's a dancer, whether it's an aerialist, we evaluate their movement. So going back to that aerialist example, a common pattern of pain and a common trouble that a lot of aerialists have is like mid-back stiffness, tightness, kind of that pain in the back of your scapula area. So what do I do as an on-site provider is we get them up in the silks. I want to see how they move. I want to see the exact movements that they're doing and then see what their muscle patterns are, see what muscles are firing. And that can help dictate my clinical examination and come up with a plan that is best for them, and or if there are ways that they can modify some of their activities that they're doing, their movement patterns, to help heal during their injury process. So it's not the expensive medical test that every medical provider needs to do. You don't need an x-ray if you have pain. You don't need an MRI. You don't need a CAT scan. 99.9% of the times, all you need is a good detailed evaluation, which includes movement. So if you are a runner and you're seeing a medical practitioner because you have Achilles pain, because you have hamstring pain, because your hip hurts, and they haven't seen you run, that is a problem. So all of my runners, because I'm seeing them on-site at Multi-Sports Academy, we have access to a nice little parking lot. We go out in the parking lot, I watch them run. I don't just put them on a treadmill, because the mechanics of running on a treadmill are going to be different than when they're running on the road. So another nice perk to being on-site at Multi-Sports Academy is we got the trail. We got the canal line right in their backyard. So if a runner tells me that their pain doesn't really come on until mile 3 or mile 4, that they don't have pain at rest, then I could say, all right, next time, next appointment, you're gonna come a little early. You're gonna go do 3 miles on the trail, and then I'm gonna do my test so I can really determine what exactly is causing your pain. So evaluating that movement is key. Gymnasts that I see, common thing that we see, low back pain, right? So it is so important for me to evaluate how they're moving when they're doing a back walkover, right? Or if they're doing a bridge, if they're a younger gymnast, and see where are they hinging in their spine. Is it coming just from one segment at that L5 segment? Because that's a huge contributing factor to why they have back pain. So evaluating that movement really gets us down to what is the cause of their pain. So it is not just enough to do simple Band-Aids to cure pain, right? So there are certain elements that I do that I will call them Band-Aids, meaning they will help you feel better. They will decrease your pain, such as whether it's soft tissue techniques, whether or not you see a massage therapist, or whether it's dry needling that I do, or you see an acupuncturist, right? All those things are gonna help decrease pain, make you feel a little better. But if you don't get to evaluating movement and coming down to a detailed evaluation and providing you on a movement-based program then that pain is going to keep coming back and back and back. So that's how we really get down to the root cause of what is causing your pain, and you need to be diligent in performing the specific corrective exercises to get yourself better. So it's not simple enough to just go to a practitioner 1 time a week, 2 times a week, 3 times a week. I've seen some clients where they go get fixed, short-term pain relief, they feel good for a couple hours, and then they keep going back, but in the long run, their pain is still there. So what we do at Spark Physical Therapy is we really get down to evaluating your movement and putting you on a plan to empower you with the specific corrective exercises you need to do. And I can't do that for you, so you need to do that. So that is going to be integral in getting yourself better if you want to remain active, healthy, and do the activities and the sports that you love. So if any of this you guys agree with, hit that like, hit the love button, just so it can help the Facebook algorithm. Honestly, put this in front of more people's eyes. Some of your friends that might be struggling with pain, some of your friends that might be starting to run more now because the weather's nicer, right? So I love seeing all the runners out there on the road. I was just talking to one of my runner friends the other day, is you see everyone come out of the woodwork now, for those that aren't running year round. So I love running in the winter and in snow and all elements, but you see a lot of people out there, and I love that. And I just saw a guy right now running down Weiss. So if you're listening to this, I gave him a nice thumbs up, gave him a nice little shout out. So it's awesome to see like all these new runners out there on the road, but they might not be aware, or they might be struggling with pain, and they really need to get down to the root cause of what is causing their pain. So I appreciate if you like, share this, or even tag a friend that is in this. So if any of the message that I talked about today resonated with you, and this is something that you feel like you need, right? You've been struggling with pain and you really want an expert to really look at your specific movement patterns and to get you on a plan to put you in control of your pain so you can keep doing the activities you love. I simply just kindly ask, I would love to work with you to see if it's a nice fit. Go to sparkyourtraining.com and we can get into a free phone consultation. Sorry, talking about the phone just fell right there. So this is live, that's what happens. And we can get down to see if it's a good fit for the both of us to work together. So I'm having my UCAN Hydrate right now because it was long run and it's humid as heck right now. I hope everyone has a fantastic weekend. Get out there, move, get out there, do your exercises. Be careful of the thunderstorms here in Connecticut, but I hope you all have a great weekend. And until next time, guys, bye.